Welcome to your X-ray positioning assessment training module for Moody Health Center at Texas Chiropractic College. I'm Dr. Corey Mayon, the Director of Clinical Education, and I'll be leading your training module. Throughout students' clinical experience, they're required to do various X-ray positioning assessments. This training module will cover what those assessments include and an example of going through one of those assessments. If a student requires an X-ray positioning observation or assessment, you're going to access your assessment portal and then fill out the assessment intro page. You'll then select X-ray positioning. You'll pick the type of X-ray and specify the region and series in the box below. There are then 6 data collection points or questions that you'll be evaluating. You may do up to 3 views per encounter. It's a lot like the adjustment observation. At the very bottom, you'll select all areas for improvement, and then you'll pick pass or fail. A passing score means that all views were of diagnostic quality. A failing score is that any of the views were of non-diagnostic quality. Remember to give verbal feedback and document that feedback on the feedback page. Here's a screenshot of the questions and the meta competencies that are tied to each question. This is a list of the meta competencies for each question. Now let's go over each question. Question number 1. Communication and explanation/consent. You're assessing if the student obtained informed consent and gave clear patient instructions on the procedure. Question number 2. You're assessing the patient positioning. Did the intern correctly position the patient? Question number 3. Machine positioning. Did the student position the machine correctly with correct central ray alignment? Question number 4. Technique, settings, and selection. Did the student choose the correct parameters, measurements, and exposure? Question number 5. Efficiency, time, and order. Did they take the appropriate amount of time and use a logical order? Lastly, is safety, protection, and considerations. Did they use proper shielding and proper equipment handling? Once you've covered these 6 assessments, you'll then move back to the feedback page. Select the assessment, which is X-ray positioning, and then do a short description of the verbal feedback that you gave the student, what went well, and things to work on. Lastly, you'll do clinical education review if required. If any film is of non-diagnostic quality, you will need to assign clinical education review. In most X-ray positioning cases, this will be the assignment of another graded X-ray view. After that's completed, type your 4-letter verification code that only you and the clinic data manager know. Let's see what this looks like. We'll select a new assessment, choose your name, select the intern you're evaluating, and the clinic that they're in. Type the chart number, and then select the case type. We'll choose the assessment, which is X-ray positioning, and click the Next button. This is X-ray positioning lab practical, direct observation of radiographic positioning. Choose the type, spinal. If it's extremity or other, you'll have to list out the extremity. Spinal, we'll put cervical spine to view. For view 1, we're going to evaluate the following statements. Communication, explanation, and consent. The student obtained informed consent explained procedures, and gave patient instructions. All of these will be graded on the Dreyfus model. Did the student position the patient correctly? Students selected and demonstrated proper patient positioning for each view. Machine positioning. Students selected and demonstrated proper machine and central ray positioning. Technique settings and selection. Students selected appropriate parameters for diagnostic film quality. Efficiency, time, and order. Student performed entire series in an orderly and timely manner. Lastly, safety, protection, and consideration. Student demonstrated correct safety protocols such as patient shielding and equipment handling and other considerations. Make sure to make a note of the view and any areas for improvement on that view. Let's make an example. Cervical spine, lateral view, and central ray was slightly elevated. So then we'll come up here and make sure that positioning is graded accordingly. Now, this is the first view. The second view has a few less questions because this question pertains to the entire series, and this question pertains to informed consent and description of the need for X-ray. So we don't have them in the second view. Patient positioning, machine positioning, technique selection, and safety. Cervical spine, A to P. There's no third view, so we'll skip this. Move on to the areas for improvement. You'll see that there's check boxes for any area that needs improvement, as well as another area that you can specify. We have patient consent, patient instructions, patient measurement, patient positioning, communication skills, the source image distance, central ray alignment. For this example, we'll have to click here. Cassette selection, combination, grid or non-grid, settings, efficiency, order, shielding, equipment handling, and development. Again, if there's something else that needs improvement, please select Other and describe it. You will then develop the films and view if all of them are of diagnostic quality. If they are, check Yes. If they are not, click No. Finish the assessment. Select X-ray positioning. Verbal feedback. Let's say that we told the student that they were very efficient. And then central ray alignment needed improvement. Clinical education review is not required, but if any film is of non-diagnostic quality, please assign clinical education review, which would be the assignment of another graded X-ray positioning. Type in your verification code, and then select Done. You've completed an X-ray positioning assessment. This concludes our X-ray positioning assessment module. If you have any questions, please reference your handouts, the syllabi, and the clinic handbook. If answers can't be found there, please refer to the following. For clinical operation questions, ask the Director of Clinical Services. For educational concerns, you can ask me, the Director of Clinical Education. And for any resources, please ask the Clinic Data Manager. Thank you so much for your attention.